Welcome to Strong and Supported Pelvic Health. This is where we are going to talk all things pelvic floor, pregnancy, postpartum, fitness, weightlifting, and even overcoming pain, because you deserve to feel strong and supported no matter what season you're in. I want you to walk away from every episode with a few nuggets of applicable wisdom, feeling more empowered in your wellness journey. Let's get started.
All right, so we are going to be talking a little bit about how when our body changes, whether it's due to injury, pregnancy, postpartum, whatever, how can this kind of change in our physical form be reflected in our, mental state? How are we going to get over those hurdles of fear, insecurity, and get back to training the way we want to be training? So Reegan Bushby is a sports psychotherapist. And Reegan, would you mind just briefly introducing yourself and kind of who you are, what you do?
Sure. Okay. Hi, everybody. Hi, all listeners and audience members. As Lindsay said, so my name's Reegan. I'm a psychotherapist based out of Ontario, Canada. So I've got a master's degree in social work, and I've been a licensed therapist since 2018. So I've kind of blended my athletic background personally to my professional life as a therapist in the last several years. And that's become my favorite form of therapy and clientele to work with. So yeah, I'm happy to be here today to chat with Lindsay.
Great. Thanks, Reegan. And I just want to touch a little bit about why this is so impactful and why it's so important. I can speak from experience of having gone through pregnancy, postpartum, and injury as well, and how it can affect just kind of this disconnect with who I am, who I want to be, what I want to be doing. I definitely felt a lot of fear getting back to things like CrossFit, for example. I did a little bit of CrossFit before I had my son, and then trying to get back into it, I was definitely worried I would pee my pants or, just have massive leakage everywhere, and trying to do box jumps and double unders. There's a lot. It's a whole lot when your body changes.
Absolutely.
Oh, let's think.
So I think we're talking about almost like stage progression, right? Or sometimes it seems like it's regression, right? Like we're coming back and then we're almost regressing back to the starting stage, right? But instead, I like to think of it as, okay, we're coming in with this new stage, right? This is kind of unprecedented. So how are we supposed to we have no expectations, because how are we supposed to know what the expectations are ourselves? So I use the example a lot because this was me, right, of being a high school and a college athlete, right? And then you enter the working world and adulthood and, your mid to late 20s going into your 30s, right? And, for some of us, that also means pregnancy, as that's kind of like our stage of life, right? And what do? How are we supposed to integrate sport into everyday life, not now being a professional or competitive athlete, at least? So really, especially we talked about, Lindsay mentioned this as her examples, right? So we injure more easily, right? Often this is including some, weight gain or weight fluctuation, which then messes with our mental health and our identity and how do we see ourselves, right? We're used to being this college athlete, without a care in the world, who heals really quickly and easily.
Right.
Yeah, exactly. And then 10 years later, this looks completely different. And it's quick, right? So this transition, we actually see it's quick. It almost happens overnight, some might say. We're sitting more. We're sitting at a desk job often, right? We're sitting in school, what have you. So this all kind of shifts our identity. So that also means we need to shift our identity of how we see ourselves. And then, we often think about the audience as well around us. So how do others see us as well? How do our loved ones see us, right? So I use the term radical acceptance a lot. You know, this is kind of describing it is what it is, right? We are who we are
Yeah.
right now. And what else are we supposed to expect ourselves to do, right? So we have in the therapy world this it's a theory called ACT, so the acceptance and commitment therapy, right? And it's a theory that we are who we are right now, whatever is happening around us, and there's nothing we can do about it right now. So it's a good place to start with, I think. And then we have the jumping off point of what are we going to do? And Lindsay comes in with that, with her physio, and what are we going to do and progress, right? So.
Wow. Yeah, it's I definitely, what did you call that? The radical acceptance?
Yeah.
I think that's beautiful, honestly. And very hard to do. Especially when you said like it does definitely change your identity of who am I? Like I used to be this way, and now within a relatively quick time frame, I am now here, and I am who I am, and it is what it is. So what are some of the beginning, I guess, stages to actually feeling that spot, you know, not constantly, like I feel like you have to be there first before you can kind of jump off. How do you be there? I don't know.
Yeah, well, I mean, that's mindfulness in its core, right? So you'd probably, you know, I'm definitely more of a science-based therapist. I'm not the best if we're going to sit there and do some mindfulness and some breathing exercises. I'm much more like action. Let's do something about it, right? But really, we're sitting there and we're being mindful, whether that's doing yoga or you know, the thing we think of when we think of mindfulness, or, you know, just having some self-acceptance, right? And whether, I mean, journaling is a really good tool for that as well. Having, you know, conversations with people that you trust, right? And just being real, like, this is what I'm experiencing. This is my reality right now. It doesn't mean that we don't want to change and, you know, improve upon that. But yeah, I like this is the here and now, and being okay with it, but still wanting more, which is, I think, fine. Absolutely.
Yeah, I like that. So yeah, finding some mindfulness in the moment. And then, yeah, definitely, I always want to set goals to be better. I will always want to improve upon myself, right? Like I don't want to just stay stagnant. And then I also think like redefining what and who I actually am now. And as like a newer mom, like my son's 4, that was kind of an identity shift for a good solid 2 or 3 years. And now it's like, oh, I'm changing my identity of who I am. I'm not so much like attached to this little creature that needs me so intensely. So then now there's this little bit of freedom coming along, that I am who I am and not just a mom. But yeah, that like identity shift is huge. But how would you kind of start the reframe of where you are to where you want to be? What are some like actionable things? Because if you're like the action taker, how do we get there?
Yeah, I think you kind of alluded to this, but it's the why, right? So why are we doing this? And I focus this on, you know, my my clients who are working on their sport. But this can be applied to honestly everything, whether it's anxiety, depression, what have you, and just general life goals, if that's what we want to do too, right? So I always ask my clients, why? Why are we doing this? Why do you want to work on yourself? Why does there need to be change? And for some people that could be, I just want to keep up with my kids, right? Like I just want to be, you know, have enough stamina to chase them around the park, right? Whatever, right? For some people, it could be a lot more, you know, clinical in nature, but really that's kind of what we're doing it for. So I think that's great. We, you know, cherish that. We focus on the why. And also I think the why is so important because if we get distracted, so if life gets in the way and we don't have time for our training sessions or therapy or whatever, you know, we have that acceptance and the, you know, guilt-free acknowledgement of like, yeah, that's life. And then we can reset back to the why. So it's kind of like our foundation, if that makes sense. And then we can then branch off with our goals around the why. So Yeah, I often recommend doing like SMART goals. Anybody could Google this. It's an acronym, and it keeps our goals really specific and measurable, and gives us a really good jumping off point. And I often recommend journaling something like that, either monthly or bi-weekly, just as a little bit of a check-in. So where am I with my goals, and what maybe needs to be tweaked? So that's kind of my behavioral piece.
Do you happen to have, like you mentioned journaling, do you offer some sort of like prompts at this point in time, or is this just kind of like a free-for-all? Because I could word vomit a ton of stuff in my journaling, but I always like if I could like focus in on something.
Yeah, I guess it depends. It's client specific, and I think the word vomiting is helpful too. So oftentimes I'll recommend just doing the word vomiting and then bringing it into therapy, and then we can dissect it. And if clients are okay, I take a peek at it and see what we can pull from it, right? And sometimes we'll pull these what we call stuck points. So the stuck points are where we're not seeing a lot of movement, right? If you could picture a joint, the joint being perhaps my hip is my crux in life. It's just being stuck, right? It's just really stuck in that joint. It's not the mobility is not there, right? So I can pull those out, and then from those we can then move on to do something like the SMART goals, or as you would, Lindsay, make a treatment plan and figure what we're going to work on, and you would then make your specific exercises and so on from there. So yeah, there are prompted journals that people can buy from any bookstore, and I think if you find one that you like, run with it. So
yeah, I almost want to make my own prompted journal for clients who are in this phase of life.
That's a good idea.
Because it would be very helpful to just be like, okay, well, what is my why? Let's talk all about it, right? And for a lot of us, it's now has become, well, I'm not living just for myself. I want to live for my family, for my child, and I want to be as strong and resilient as possible. Because, I mean, motherhood feels like a sport. So, I mean, train like one. But yeah, it's definitely, I get what you mean by those like stuck points. So if somebody were to identify their stuck points, you're saying kind of like self-reflecting and take that and kind of just journal through it.
Yeah. I mean, from a more macro perspective, in the moment when we see these stuck points coming up, this is almost like we use this in trauma as well. And when we're working with trauma, which we could probably extrapolate as to what we're working with, there's also an overlap with physical injuries, right? Birth, so, some would coin birth as a trauma, right? It's inflicting trauma onto the body, right? So any sort of change, I would indicate that as well. So my preamble aside, what we would do with that in the moment, if you're noticing the stuck point coming up a lot, almost as like a trigger, right? I like to say we have the 3 C's is a easy thing to remember within the cognitive behavioral therapy world, which is what I live, eat, and breathe all day. We catch it. So that's the first C. So we're catching whatever's coming up for us a lot. So if there's a theme and we're noticing it, right? We're going to check it. We're going to check, okay, is this helpful for me? Is this helpful for me? Yes or no? And often I always tell my clients, if we're already doing the 3 C's, it's probably a no. It's probably not helpful for us, right? So that's an easy one. The hard one is the 3rd C, the change. So we're doing a catch, check, and change, and we're changing and almost, I like to say pivoting, because we all know kind of what a pivot is, right? So we're pivoting away and towards something else. So, whether that's, I don't know, a different goal, focusing our direction somewhere else. Sometimes we're really hounding on the same stuff over and over again because we fixate. So sometimes it's helpful just to kind of pivot away to give our brain a little bit of a break.
I feel like pivoting would be very hard. Like if I'm fixated on something, it is going to be like, you do not pull me away from that fixation because it's almost like that has become part of a new identity for me. Like if I'm really struggling with something, and I could imagine that, like you said, in the trauma realm, or just that this whole phase of life for a lot of women, it's that almost like this feeling of loss of identity, and I have literally no time for who I am and what I want, and everything's just eaten up by motherhood. And so it would be hard to kind of like pivot away from that. How would you like baby step away from one of those like stuck points, I guess, and help pivot?
Yeah, I think that's reminding me of the grief process that we go through with loss, right? And some might say, okay, maybe we're being dramatic about, our pre-motherhood as a, loss, but it's true, right? And it is something that we need to grieve. And I think that, we can talk ourselves out of it of, well, of course I've got, my child, so how could I ever want to grieve something that wouldn't have brought this person here, right? So, but in the therapy world, I would push that a little bit, right? And say, well, we have to grieve with what once was, right? So whether it's, pre-pregnancy, pre-motherhood, whatever it is, insert here, and I think it's okay to be sad or frustrated or resentful is what I get a lot, right? And I think that if we're feeling like we can't do the pivot, we can't get away from that stuck point, we've got to sit with those feelings and those emotions and allow them to come out unapologetically, right? This is what I'm feeling. And, if this looks like a good cry or whatever's happening, some anger, maybe we're switching to the punching bags. I don't know. We'll have to see, right? But that is really the first step, is the acknowledgement and the feeling of, okay, this is where I'm at now. This is kind of bringing it back to what we talked about at the beginning. Right, Lindsay? So like we're talking about what's in the present moment, what's here, and then let's acknowledge it before we can start to add things on, add the goals, get the movement going. So yeah,
I think that's a great point to be like, yeah, definitely it brings it back to actually that acceptance phase of where you're at and being like, this is unashamedly where I am, and these feelings are okay. I think that happens a lot, is like if we're feeling this resentment or frustration or, obviously we don't want to feel that way, because then that makes us feel like a bad person or feel like a bad mom, or, it can spiral. But yeah, I think unashamedly feeling that would be the first step. And then almost like before you could move on, you have to like button up that process to be like, I can't just pivot when I haven't dealt with being okay where I'm at.
Definitely. Absolutely. And I think it's okay to regress back to that, or what we call a relapse, right? So if we relapse back to that in the moment, that's fine, but we have to acknowledge it, deal with it, go through the emotions. And then our hope, especially with therapists, we watch this, right? So how often between, relapses, how long has it been, right? So, okay, I'm really struggling, once a month. And then hopefully the time would be every 2 months, every 3 months, right? And then it gets further and further away. And that's when we see the growth. So it's not linear by any means, which is what frustrates people. And we lose a lot of momentum there. But knowing that, maybe we can even prepare for that, prepare for the, the non-linear approach to healing, right?
Yeah, I definitely see that in the physical realm as well, right? Healing is never linear, and there's always going to be a regression, or we test the boundaries a little bit, and then there's, oh man, that reproduced my symptoms a lot. And then people will kind of like step back and be so frustrated and be like, I'm way back here, but it is almost like this, instead of like calling it injury prevention, I almost feel like it's injury preparedness. Is in a sense of way. So like, oh, I've been here before. I know how to get out of this. I've done it before, right? As opposed to this like catastrophizing, oh crap, I'm here again. And all of that was a waste. And now I just failed, right? Versus that was data. I collected data and now I can move on and build from it. And then, yeah, like with my injuries and my back pain and things like that, it used to be very frequent. And now it's so infrequent that when it does happen, I have to remind myself, this is okay. I've done this before. I can get out of it again, which is definitely really helpful for kind of that bridge between my realm and your realm of the mental side of things as well.
Absolutely. We call it preparing for the hurdles, right? So what could the hurdles possibly be, which sometimes looks like a relapse back. And then what are we going to do when that happens? Because it's almost like a when, it's not an if. And I think setting those realistic expectations with clients is going to get you not only, more of a prepared client moving forward, but also one that's going to, have more success. And, also in the client realm, when you and I are working alongside clients, we want to see progression. We want to see people who graduate from us, right, and get better and don't need us. But knowing that also we can come back if you ever needed, a booster session, or I don't know what you call it, Lindsay, but if we need to touch base, then we're here, and we've got, that in the relapse plan that we've got it if we need it. So.
Yeah, I love that. And that's why kind of like working the way that I've decided to work, I don't, in my head and in my mind, I don't ever like cut ties with clients, because I discharge them and I'm like, okay, well, follow these progressions and plans. And if you start to notice this, then yes, come seek help. But oftentimes they can just have the skills that we've worked on and then just start revitalizing it. And then they end up back way faster where they wanted to be, without having to even seek my guidance. But yeah, I'm still there, and then, facing any other sort of concern or injury, they could definitely come in. But yeah, I love that mentality of being prepared, and it's not never going to happen again. It's when.
Yeah.
What was your phrasing that you used? It's not.
Yeah,
when.
Definitely. And I'm just more realistic. I'm a realist. So, and if it's not going to happen in this specific way that we prepare for, something similar, in parallel is going to happen. Whatever the setback is, let's just make sure we've got that, that relapse prevention plan, so that we don't go all the way and stumble all the way down the hill. We stumble a little bit, and then we can pick ourselves up and use our coping skills that we've implemented. So.
Great. Well, I feel like we've talked a lot about a lot of really good things, kind of about how to find your why. And during the identity shifts of injury, pregnancy, life changes, to really dial in the why and the here and now, kind of finding who we are and redefining and being okay in this space, and then using specific tactics to pivot ourselves. You kind of mentioned the SMART goals, which are like specific, measurable,
Attainable
and time specific, right? Something like that.
And realistic. Yep.
And realistic. Yeah. I forgot the R. I was doing SMAT goals, but yeah, realistic too, because a lot of times people want to achieve something in a unrealistic time frame, and they're like, well, I mean, I injured myself like 4 months ago, but a lot has to happen for you to get back to running an Ironman, and definitely women have this bounce back feeling of I need to be who I used to be, and there's a very small time frame, and that's what everybody seems to be doing, and it's definitely not realistic and definitely not attainable for most women. Your body does change, and it's gonna stay changed in some ways. So yeah, What else did we mention? You mentioned like journaling and how you can kind of work through with different prompts. And then you mentioned the 3 C's when you have kind of these stuck points of things that keep reoccurring.
Yeah, and especially when you're on the merry-go-round and it's going round and round and round, right? That's often a good time to use it, or if you're triggered by anything, right? So we have what's called intrusive thoughts, and really it's any thought that you don't want there. That's how you can coin it. It's intrusive. It's breaking in. That's a big time to use the 3 C's. So we're catching the thought. We're acknowledging it. And I think this is a big difference too, which maybe I didn't talk about in detail, but we're not suppressing it. We're not pushing it down. We're not avoiding it. We're acknowledging it, right? Head on. Okay, I see you. You're intruding in, right? That's the catch. The check, is it helpful? No. And then if not, I'm going to change the pivot, right? So pivoting from there. So we're not avoiding. We're not avoiding here.
I think that's a really good distinction, because I do have intrusive thoughts. And then if I have one, I just immediately like try to expelliarmus it and it doesn't work. Something else comes back. And then I'm like just fighting off all of these thoughts, as opposed to being like, well, let's sit with that for a second. Why was I thinking about that? What in my life right now is making me feel like XYZ, right? And then just pausing, because I think if I paused on some of the things, I could work through them, as opposed to just like avoiding it forever.
Yeah, we can do a lot of good with pausing. That's a big skill that we try and implement in, right? Yeah. The pause before the do is really the pause before saying something. We could all benefit, even in society, from a little bit more pausing.
Did you mean to say that? Oh man. Well, I think we can kind of summarize everything and finalize. We talked a lot about really good stuff that I think is very applicable to anybody really, not necessarily the women I work with, but just people in general. So any last little tidbits of wisdom or?
I don't know. I mean, ask for the help, reach out, right? Like, we don't have to do this alone. I think that's a big thing. Find your community, whether it's a gym, whether it's a couple, girlfriends that you can get along with and, be, unapologetically you, someone you can have, a FaceTime call with. It doesn't have to be a clinical therapist by any means. We can have our helpers and other aspects in the community, right? I get a lot of support from my dietitian, and that's kind of like my therapist, so whoever you need to kind of create your community, I think is going to be, at least, if not, the next step. It's a good step to start with. And then it brings in that accountability automatically, which is what we like to see.
Yeah, definitely finding that community and accountability is huge. And like you said, it doesn't have to be someone, even a specifically trained therapist, but if you don't have anyone, like find somebody, find something, get involved. We are not meant to do this in isolation. So, well, thank you so much, Reegan. This was great. And great to chat and to catch up a little bit.
Absolutely. Thank you, Lindsay.